Surgeons at Washington University School of Medicine in St. Louis have developed a procedure that may help restore some hand function to quadriplegic patients with spinal cord injuries in the C6 and C7 vertebra, the lowest bones in the neck.
This procedure is unique because it does not attempt to go back into the spinal cord where the injury is. I am not a spine surgeon. I'm not a neurosurgeon. I do surgery in the upper extremity. I do surgery on peripheral nerves. So using that expertise to bypass the area of spinal cord injury, we stay out of the area of injury, go out towards the target, which is the hand. We want to make the hand work again. And we actually jump the level of spinal cord injury, reattach the brain or volitional control of the hand. This surgery is for patients with very specific levels of injury. They must have function at the elbow, so they must be able to flex their elbow so that we can borrow nerves there and reattach them.
In this case study published in the Journal of Neurosurgery, the patient's injury is in the C7 vertebra. As a result, he had some shoulder, elbow, and wrist function, but no hand function prior to the operation. Because the technique relies on working nerves that attach to the spinal cord above the C6 level, it won't benefit patients with injuries that occur higher than that.
It is not to restore leg function or other functions in patients who have lower spinal cord injuries who are called paraplegics. This is a very specific surgery to help patients who have a spinal cord injury where they do have shoulder, elbow, and some wrist function, but no hand function. So the patient has nerve fibers that are connected to muscles below the level of spinal cord injury, but their brain can't talk to those nerves to make the hand work. What I'm doing as a surgeon who works primarily in the arm is I'm going back out to the arm. I'm taking an extra nerve that's still attached to the brain and jumping it over to provide the signal for some hand function or prehension so they can independently grasp objects which they weren't able to do prior to the surgery.
After the surgery and a year of intensive physical therapy, the patient regained the ability to pinch and can now feed himself and write with some assistance.
With this surgery, some patience is required because there's not an immediate result, because when you cut the nerve, unfortunately, the nerve fiber will die back. So we have to cut the nerve to reroute it and splice it to the nerve that we didn't have control over. And when we cut it, it has to grow back. It will grow back. It takes about a month to get an inch of growth in that nerve, and it will grow back to the muscle that we want to get control over, but it will take several months to a year. So they won't wake up and all of a sudden be able to pinch. It's usually at about 6 months that they start developing a flicker of motion. So they do a lot of therapy. It's sort of tricking the brain and re-educating it to say, okay, what used to bend my elbow now bends my fingers. And then that muscle also will require some time to strengthen back up. It hasn't been used from the time of the spinal cord injury, so it's weak, and they have to build the muscle back out. If they have stiffness in the fingers, they may require a lot of therapy just to get supple joints back, and in fact, we want them to do that before the surgery, because once the nerve and the muscle starts working, we want those fingers to be supple and not stiff or locked in.